Namaskar, this is Dr. Vipul Gurjar. I am the professor and head of the Department of General Surgery in SPKS Medical College in Vadodara. Today we are discussing about the need of laser energy for piles. After in a workshop and in a personal level also, when the surgeon is starting about the pile surgery with the laser, the first question will be that sir, what is the dose of pile per pile mass? And second problem, after doing the surgery, one or two surgery, there will be a call. Sir, I have a bleeding after the laser surgery, so I am afraid about the laser surgery. Okay, so this is the one of the most two common problem, the dose of pile mass and the bleeding after the surgery. It is why, first thing, there is a nothing, or there is a no calculated established dosing system for the pile mass. The companies, many companies are saying that please keep this machine at the 7 watt, use 150 piles or pile mass. So everyone are doing with the same manners. See, everything will be changed. You can see yourself also. If you are putting a continuous watt, then your energy in a 20 second will be changed. If you are putting in a repeated mode, then energy will be changed. If you are using a conical pile mass, the need of energy will be a different. If you are using a bare fiber, then energy will be need of energy will be a different one. If you are using a bare fiber with the steady point, the energy need will be a different. If you are using a bare fiber and if you are moving the tip inside the pile mass, then the need of energy will be a different one. What are the problems? Because the the companies are saying something different. The old stalwarts, the in a conference, they are giving their views and we are accepting that this may be the ideal situation and ideal energy. But be practical. You have to need understand yourself. Okay, so I have given the example that the laser energy vary according to this all about these steps. Okay, now further, the small piles, second degree, third degree piles, fourth degree piles, larger piles externally present, thrombus piles, internal external piles, circumferential piles, accessories piles, these all are required and need of different energy. In a conference also, the or in a many by many surgeons, they are after the laser lecture, they are showing the one or two photograph of the complication of the laser. This is the complication and this is energy given, and because of this energy this type of damage is happened, and these are the necrotizing facilities occurred because of the larger dose of inadequate dose of energy. This is something wrong, because one or two slide is showing everywhere in the conferences or with the person. I don't have that slide, or I maybe a same slide also to show in a workshop. Normally, according to companies as well as with the experience, the second to third degree piles may require energy of 150 to 250. Okay, but it is not a limitation. It is not a like that we should not give above the 250. First thing, we will discuss about higher energy if you are giving. don't worry of giving the higher amount of energy. Okay, is there any judgment on table? Yes, I am giving the clue about the judgment. How you are how will you get the judgment that this may be the enough energy? What is the principle of Pile's laser surgery? The laser is make a hemostasis. That means when you are enter the tip inside, there will be a tissue destruction and there will be a formation of hematoma. That means you are creating a artificial thrombus piles. Okay, so once you are giving the energy, then if pile mass becomes a firm in nature, is in compared to before giving the laser, there will be a soft because it is a vascular cushion. And then after the giving this laser, there will be some firmness is appeared. Then it is adequate energy. This may be a vary about the 250 to 350. Don't worry about this. If this much of larger hemorrhoids, if you want to use laser, in that case you need to increase a pile's laser energy, then it becomes a thrombus one. That means adequate hemostasis will occurs. Sometimes what happens, because of the fear of less energy and the spread of this complication, the peoples are afraid to give not giving the adequate energy. What happens, they are starting with the laser, and what happens, there will be a trauma to the blood vessels and they are starting with the hemostasis, and because of the fear of this bleeding, they stopped doing a laser, and there will be a inadequate hemostasis, and because of this inadequate hemostasis, there will be a hematoma formation or spread to the lateral structure, and that hematoma and bleeding goes in skin and subcutaneous tissue, and that becomes infected, and that causes a necrotizing fasciitis or the abscess formation. So don't worry about the energy. Yes, ideal situation 150 to 250 is enough one, but according to the pile's degree as well as which fiber you are using and what machine is settled, that means a 7 watt, 6 watt, 8 watt, that as well as your hand movement, this all makes a difference. Okay, first thing, do not worry if you are larger pile mass, you can give the adequate energy till there will be a firmness in the pile cushion or pile mass, but you should not tear the tissue on table. Okay, there should be a firm thrombus formation inside the pile mass, then it will be, you will get the result of laser. Inadequate energy, you will not get a good result. Okay, second thing, you are afraid of bleeding. This is because you are not giving the adequate energy, then the bleeding will occur. If you have started, you have to complete the process. Okay, third thing, if you are touching the mucosa and you are giving a continuous energy, then there will be a definitely a mucosal injury and everything, but you have to keep the tip just distal away from the mucosa, and there won't be a problem if you are giving a 100 or 50 or 150 joule more in this situation, there won't be any problem. Okay, fourth thing, if you are giving starting the energy, and you said Dr. Vipul has said give the energy as you much, but sometimes on table there will be some crackling sound and there will be a continuous shrinkage of piles you can observe, and this shrinkage is indication that your energy is absorbing by the tissue, and now you will get definitely a hematoma formation, and this hematoma becomes a lysis and fibrosis in our next 3 to 4 weeks. Okay, so don't worry about the higher energy or lower energy. Bleeding will be occur if you are not giving adequate energy, and you can give more than 350, 400 according to your need, and beware, it should be only in the pile mass. as well as the fraction. That means you don't give the with the continuous, you start and continuously 350. No, rest, every rest, every 50 to 20 second, observe, further give the energy, observe, 20 second, further give the energy, observe. That means every 100 joule energy you have to observe about the result on table. Meanwhile, your hand should be a steady one. That's why the tip will not injure them, because otherwise there will be a more problem. So the message is, there is no standardization of energy per pile mass in the laser. It is even the 150 250 is not an ideal criteria. About 350, that means a danger zone. It is also a wrong misnomer in a particular pile case, not everywhere. But if you are giving like a small piles, and if you are giving the 350, then there will be a tearing of the tissue, there will be a creating problem. But if a larger pile mass, and there won't be larger pile mass, if you are giving a 250 joule and there won't be any firmness formation, there will be a failure of the surgery. Okay, so this is my message. Thank you very much. Bye.